senior spokesman for CARP Nova Scotia and the moderator of these webinars that we do regularly. And we're very pleased today to have Laura Lundquist back from us from Zoomer Physio. Laura has done a number of webinars for us over the years and is always very popular, has very interesting information, and we're really pleased to have Laura with us. For those of you who are wondering, we are recording this so that we will be sending in a week or so. We do some editing so that you don't get the stuff at the beginning and the end that you're not interested in. You just get the meat of the presentation. We will send that out to you, and also any other information that Laura wants you to have, and that comes out in about a week and a half. It takes me that long to have the time to edit it and get it out to everybody who registered. So thank you very much for attending. CARP Nova Scotia is always happy to have so many people aboard. And if you're not a CARP member, please go to our CARP website, which is carpnovascotia.ca, and join. It's only $20 a year, gives you lots of opportunity. It adds to our numbers of almost 10,000 members in Nova Scotia at the moment, so that we can help advocate on your behalf. Having given the introductory commercial, I'll now introduce Laura. And Laura, the next hour is yours.
Awesome. All right. Thanks so much, Bill. Always such a pleasure to be here. I nearly got muted for the presentation. That would have made it interesting. I do talk a lot with my hands, but probably not for a full hour. So again, thank you to CARP for having me here. Happy to be here. Love, love, love sharing information about health and well-being and helping people just live their best life and living your best life, even in the face of sometimes managing different health conditions or just even managing the process of aging. Because let's be honest, it's not easy, right? Things come up and things require management. And so, but we can still live a great life. We just sometimes need a little bit of help along the way. So, as you can see, I'm super serious and very low energy, and hopefully you can have a nice nap for the next 45 minutes. But no, in fact, I would love it as we go through here. If you're feeling stiff, if you're feeling sore, stand up, move around, do something. Don't just stay sort of sitting and then have a sore back after this 45 minutes to an hour with me. I'm just going to share my screen here and we'll get into it. If you were, depending on when you joined on, you may or may not have heard me say that it is of value to grab a paper and pencil or a pen. So if you don't have that, I'm just going to give you 20 seconds right now to safely go grab a pen and paper so that you can participate in this first little activity that we're going to do together here. All right. So our bulk of our topic here today is talking about managing hip and knee osteoarthritis optimally through exercise and through education. And I will talk lots about those things and a little bit about some of the other things around the edges. And then I'm happy to take your questions at the end. So I will definitely leave time for a Q&A at the end. And like Bill said, if you've got a question that comes up, please feel free. Bill, I think we'll keep track of it a little bit as we're going. And if there's a reason to really hop in and interject, Bill, please feel free to do so. But also, if it's just not the right time for me to answer that question, then I will just wait until we get to the end of the end and we get to that Q&A. And when we're there, then I will just go through that list of questions and then answer anything else that comes up at that time. Okay? So here is the time for your pen and paper. Before we talk about anything, I want everyone to take the opportunity here to just do a little short self-assessment. And what I want you to write down is yes or no for each of these questions. Or if it's a yes, you can do a check mark. But probably the easiest thing to do is just to write down yes or no for each of these questions. I'll read them out and then you can just write yes or no. First one, do you often have hip or knee pain after walking, standing, or enjoying activities that you love? Yes or no, just write it down, don't overthink it. Do you feel stiff in your hip or knee in the morning or after sitting for a long period of time? And that makes it harder to get moving the way that you want and with the speed that you want? Do stairs, squatting, or kneeling feel more difficult than they used to, particularly because of hip or knee pain or stiffness? Does pain ever keep you from joining in with family or friends because it limits how far you can walk, or you feel it makes you limp as you're going? Again, just yes or no. Do you notice clicking, grinding, swelling, or a feeling that your joint might give way, leaving you less confident in your movement? Has hip or knee pain caused you to avoid activities you once enjoyed, like gardening, traveling, or playing with your grandchildren? And then lastly, would you like to get back to moving with less pain, more confidence, and the freedom to do the things that matter most to you? All right. So if you answered yes to two or more of those questions, your hips or knees are probably holding you back more than you realize. And the trick is, although they may be holding you back right now, physiotherapy can help reduce your pain, improve your confidence, and get you back to enjoying the activities and the people that you love. And so that's why I'm here today, is to talk about how we do that. Our goals are, my goals for you, and hopefully your goals are that you walk away today with a better understanding of the pathology of osteoarthritis, or what's happening in a joint that is affected by osteoarthritis, that you've got better awareness of the impact that you can have on your joint health through physical activity and exercise, that you've got better knowledge of some of the self-management tools that are out there and available for you, and that you feel empowered and inspired and ready to get started. Because the earlier we can start working away on these things, the faster and the more impact we can have. So before I go deeper into the content, just a little bit about me. I am a physiotherapist, have been since 2003. I know that's hard to believe. I often say I just came out of the womb as a physio, just a child prodigy. But I have been practicing since 2003. I have advanced skills in manual therapy and my sport diploma, which gives me sort of an interesting perspective on joint health as well as physical activity. And I have a really strong focus in my practice and in my beliefs about exercise and the importance of active rehabilitation, or using your body to rehabilitate and recover from injury and manage chronic conditions. And it was this background and this passion that encouraged me, or sort of was the inspiration to open Zoomer's Physiotherapy and Health Solutions in 2018, where we really focus on helping older adults live their best life. And we do that through a number of different programs and services that we have. And then we expanded in 2024, for those of you in the Halifax area, to the other side of the bridge over into Cole Harbour with our sister clinic, Spring Physiotherapy, in 2024, with the same sort of philosophy of care. And we were the first clinic in Nova Scotia, and this is something I'm really, really proud of, to offer a program called the GLAD program in Nova Scotia. So the GLAD program, I will talk a little bit more about when we are talking about treatment interventions for hip and knee osteoarthritis, but it's an international program. It came to Canada in 2016, and we were the first site to offer it in 2018 and have been offering it since then. So management of osteoarthritis is really, I've certainly done it throughout my practice, but it's been a really, really big part of my practice and focus since 2018. Our roadmap for today, we're going to talk a little bit about the condition itself. Again, like I say, just to have a bit better understanding of that. We're going to talk about the impact of osteoarthritis on quality of life, and that helps us understand how important it is to be sure that we are managing it as best we can. And we're going to talk about exercise for hip and knee osteoarthritis, what that often looks like, and then about some self-management tools over and above just exercise. And again, like I say, anywhere along the line here, if you've got a question, feel free to pop it in the chat, and Bill will interrupt, or we will have a look at it at the end. So the pathology of osteoarthritis and what's actually happening at the joint itself, excuse me, it's important to remember that osteoarthritis we consider a disease of the joint as opposed to a systemic disease. So there are other inflammatory arthropathies or types of arthritis like rheumatoid arthritis and lupus, ankylosing spondylitis, and a number of different conditions, which are all types of arthritis, but not osteoarthritis. When we're talking about osteoarthritis, we are talking about a process that's happening at the joint level. It certainly can happen at multiple joints in the body and can happen anywhere in the body. It's most common in the hips, knees, and hands, but we also see it frequently in the spine and as well in other joints. We used to refer to it as a wear and tear injury, right? And this is language that we are working really hard to get away from, because when we think of something as being wear and tear, it tends to lead us to believe, with good reason, that we've overused that area, therefore we should probably stop using it in order to help that joint be as healthy as possible. But in fact, what we see is that the process of osteoarthritis is really just happening because there becomes a mismatch in the rate with which the cartilage on the ends of the bones, so two bones, when they come together in a joint, each of those bones is going to have a layer of articular cartilage on it, almost like saran wrap. You can almost think of it like that. It's smooth, it's slippery, it reduces friction so that those bones can move easily on one another. And that articular cartilage or saran wrap is always in a process of breaking itself down and building itself back up in order to stay healthy. That's just the way that tissue behaves. What happens in osteoarthritis is that the rate of breakdown becomes faster than the rate of buildup. So if we're breaking something down faster than we're building it up, then it makes sense that that is going to thin over time and get smaller. And that's what's happening in osteoarthritis. So it's not that we have worn it out, it's that this turnover cycle of the cartilage is actually now has a mismatch. That increases the friction in the area. It reduces how much stability or how stable the joint is, and ultimately results in pain with use. And so this becomes particularly a problem when we think about hips and knees, which is the focus of our talk today, because the hips and knees are weight bearing joints. So when we stand up, our body weight is going through those joints. And if those joint surfaces are unhappy because the articular cartilage has thinned, then when we put pressure down through those joints, it's painful. And shocker, we don't love doing things that are painful, right? So, what we see happening to people with osteoarthritis is that they often start decreasing how physically active they are and staying off their feet because the pressure going down through the joint is painful. And although that makes some intuitive sense, the problem with that is a couple of things. Number one, if we're not physically active, our muscles get weaker. If our muscles get weaker, they can no longer protect the joint. And now we have a joint with osteoarthritis that also doesn't have the dynamic support or the active support of the muscles. And so then we do have to be up on our feet some of the time. And when we're doing that, then the pressure in the joint becomes even worse and it becomes more painful and we get stuck in this cycle. The other thing that we know is that that articular cartilage in the joint, the way that it stays healthy is by having pressure down on the joint and then pressure releasing. And that's because that cartilage has little sponge like molecules inside of it that are what's responsible for bringing healthy fluid into the cartilage to help nourish it and then to push the old fluid out. And because that cartilage doesn't have any blood supply, this is the only way that that tissue is nourished. And so if we aren't getting that load, unload by being up on our joints and putting pressure through them by walking and doing other types of activity, then we see that that cartilage becomes less and less healthy, contributing to more and more advancement of the osteoarthritis. So that's what's happening at the joint itself. But how does this impact our quality of life? Obviously, our joint is painful, but not only is it painful, that pain, the stiffness, and the resulting instability, understandably, number one, we don't want to do as much because it hurts, but also we start feeling less confident in our ability to do those things, right? Because we just maybe don't trust that our knee is going to be strong enough on that hill. We don't trust that our hips are going to be able to handle the uneven terrain or whatever it might be, or being out on the beach. And so we start losing our confidence in our physical ability and what we can do. And that causes us to start pulling back from the kinds of activities that we love, right? And spending time with the people that we want to spend time with. Also, we see sleep disruption becomes a major issue for people with osteoarthritis. And that obviously can leave us feeling more tired. Limping also can leave us feeling more tired because of the amount of muscle compensation that needs to happen in order to help us along when we have to walk in these sort of altered ways or different ways. And so, if we're feeling really tired and we're feeling like we're limping, these previously enjoyable activities, like maybe going for a walk on the beach or taking your grandkids to the playground or out to the zoo or whatever it might be, you know, suddenly those sorts of things just start to feel like they're too painful and they're too tiring and it's just not worth it, right? And again, we start pulling back from those things that we love. And not only is this a problem from a physical health standpoint in terms of your muscle strength and your balance and your mobility and your heart and lung health, but it's also a problem from a mental health perspective and an emotional health perspective and even a cognitive health perspective, right? We know how physically active we are is protective, like exercise is protective against cognitive decline and dementia and Alzheimer's. And so if we're starting to pull back from physical activities, we're now not only seeing changes potentially in physical health, but also in mental health, emotional health, and cognitive health. So it's important to remember when we think about whether or not we are going to be really proactive in managing hip or knee osteoarthritis, that it's not just about the joint that we're talking about. That's part of it for sure, but it's also about making sure that we're managing our life well so that we can do the things that we want to do, right? You're going to keep hearing me say that over and over again because I think it's so important. Okay, so when it comes to management options, generally speaking, we are going to talk about management options for osteoarthritis in three different lines or three different tiers of treatment. The first line of treatment is education, exercise, and weight management. And we know that this is appropriate for everyone with hip or knee osteoarthritis, regardless of where they are along the spectrum of disease progression. If it's very early days, or if you're perhaps awaiting a total joint replacement, we know that understanding the process better, doing appropriate exercise, and managing body weight as best we can are important and relevant for everyone. Second line treatments would be the next sort of level up of care that we look at for management. So these would be things like medications, passive therapies like coming to see a physiotherapist, bracing, gait aids, so things like walkers and walking poles and canes, those sorts of things. We're going to talk a little bit more about that a little later on tonight. And then the third one is the third line of treatment or the third tier is surgery. And here we're talking really about partial or total joint replacement surgery. But here's one of my show-stopping facts of the day, which is only 3 to 5% of people with hip or knee osteoarthritis end up needing surgery, right? I think a lot of people, as soon as they get that diagnosis, feel that they are immediately at some point going to need to have joint replacement surgery. And that's just not reality. Most people, the vast majority of people, can manage well through first and second line treatments. But the earlier we are taking action and getting a handle on things, the more likely you are to be able to stay out of the operating room. And ideally, if we can stay out of the operating room, that's a good thing, right? All right. So, excuse me. I am just getting over a cold. So please pardon my coughs. First line of treatment here. Education, exercise, and weight management. Like I said at the beginning, this is appropriate for everyone along the spectrum of hip and knee osteoarthritis. Education, this first part is really about understanding how the joints and body are impacted by osteoarthritis. So at a deeper level, you're already starting to get a little bit of the education by being here with me tonight. But even understanding a little more about what's happening at the joint level and how you can really impact how your body is managing those changes. The next part is really learning how to interpret the pain from your joint. So, you know, we're used to interpreting pain as it's really our body's threat system, right? If something is painful, if the stove is hot and I touch the stove, that hurts, that teaches me don't touch the stove, right? Hopefully, you only have to learn that lesson once and then you don't touch the stove again. The trick with osteoarthritis is that we get these pain signals from the joint that our brain has been taught to interpret as threat, and that we should not do the thing that is creating that pain. But actually, within reason, working through a certain amount of discomfort, as long as you know what you're doing is appropriate and safe for you, is often actually the number one way to actually having less discomfort and higher level of physical capacity or physical ability. And so learning how to interpret those pain signals and understanding what is an appropriate and a safe amount of pain and what's an amount of pain that you really need to pay attention to is a really helpful lesson to learn. The next one, excuse me, is learning how you can use exercise again to reduce your symptoms and improve your quality of life. I already sort of hinted at that, but exercise can actually cause this desensitization phenomenon where, because you are repeatedly doing the same thing and your body starts to see, oh, actually, when I do these, let's say squats, um, there nothing really negative is happening here. Okay, maybe squats are actually okay. And then when you go to do a squat, it's not so painful, right? Because you've taught your body that it's not threatening. And so learning how you can do that is really important, because then again, that translates into hopefully how confident you feel to go out into the world and do the things that you want to do without being worried that you're harming your joints or doing something that you shouldn't be. When we talk about exercising to help manage, so that's sort of the education piece. When we talk about exercising to help manage osteoarthritis, I already talked a little bit about this. That cartilage health, the cartilage that's on the ends of the bone, in order to stay healthy, it requires this loading, unloading that we get when we're walking, to a lesser degree, but still similarly when we're doing something like cycling. And so it's important that we optimize the health of the cartilage that is remaining in the joint. And so we need to make sure that exercise is weight bearing, putting pressure down through that joint so that we're getting that loading and unloading of those tissues. We also know that exercise, the right kinds of exercise, so strengthening exercise, can help build our muscle strength. And muscles are really our shock absorbers for our joints, right? They're responsible not only for holding the joints in good alignment so that the forces are distributed properly through the joint as it's intended to be used, but also because they have the ability to absorb incoming force, they can protect the joint from that jarring movement that would otherwise get to it. So by increasing the strength of our muscles, we can reduce the shock that makes it all the way to the joint. And also by making those muscles a little smarter. So we talk a lot in osteoarthritis about neuromuscular strengthening exercises, which is a bit of a mouthful when it comes to language. But what we're really talking about when we talk about neuromuscular exercise is trying to make sure that we have a really good brain muscle connection happening, so that we've got the right muscles turning on at the right time to coordinate how our hip, knee, and foot are moving together, so that we move efficiently and use our muscles well. And we also reduce abnormal stress in the joints. Because of the muscle weakness that often happens with osteoarthritis, it's very common to see people get into um, compensated movement patterns. So regularly with knee osteoarthritis, we'll see that the knee collapses often inward towards the other knee. Sometimes we can have sort of structural change where it looks a little different and bows outward like a bow-legged position, but more often than not, we see that knee coming inward. And that's a function of the weakness in the thigh muscles and in the buttock muscles. We see a similar thing with the hip, but the weakness in the hip muscle causes the hip to sort of tip out to the side. And again, unfortunately, these changes in bony alignment or joint position cause increased stress on the affected part of the joint. And so we end up with more pain associated with that osteoarthritis just because of the compensations that our body is accidentally making. The other way that exercise can be helpful is by decreasing. We know that exercise can be helpful in body weight management. And so, if we are able to better manage our body weight, we can understand for sure that less body weight equals less mechanical pressure going down through the joint. And so, that's one way that managing our body weight is helpful. But the other way that managing our body weight is helpful, and again, exercise helps us do this, is that it reduces our systemic inflammation. And that, I talked about osteoarthritis as being a disease of the joint itself, which is true. It's a disease of the joint. But if the inflammation in our system is high, right? System wide inflammation is high, then that has an impact on how that joint with osteoarthritis will behave, and it is most likely to be more sore. So, anything that we can do to reduce systemic inflammation, sometimes we talk about healthy eating as a way. There's anti inflammatory eating that we can talk about. Reducing the number of fat cells in the body reduces our systemic inflammation. And just the process of being physically active also reduces our systemic inflammation. So,
Laura, one of the questions related to that in the chat is, are there supplements like glucosamine that can help cartilage or joints?
yeah, great question. So, I'd love to tell you that there's a magic something out there uh, that works for everybody all the time. And if there was, we would all know and everybody would take it. The answer when it comes to something like glucosamine chondroitin is that the research is sort of ambiguous. It's not there's no slam dunk there, but definitely some people do find that supplements like glucosamine chondroitin are helpful. And so generally, I'm a physio, so medication and supplements are outside my scope of practice. So the first answer is definitely you should speak with your physician or pharmacist or naturopath about anything you're considering taking. But usually the suggestion would be if you're going to try something like that and you safely can, that you should try it for a period of 6 weeks, then try not having it for a period of 6 weeks and see if you feel appreciably different, right? And then you can sort of make your own decision from there. Of course, the other thing to be careful of is that you're not also at the same time engaging in an exercise program or something, which may also, and I would say more likely to be giving you positive benefits. So it could, I always think of my grade 5 teacher, Mrs. Archer, always try to change just one scientific principle at a time. Or one variable at a time. Sorry, scientific principles change one variable at a time. And so, when we look at the research, there has been so much research about the effectiveness of exercise for managing hip and knee osteoarthritis that the recommendation in the research is stop researching it. We know it works. Go look at something else, right? So, almost always, for anybody here who ever follows medical research, almost every article or meta analysis at the end of the big review, it says, but further research is required to confirm that this is in fact going to be helpful. We know that exercise works. So, supplements, you may find some help, and it's certainly something worth exploring. But I'm biased as a physio who believes in active rehab, like I said at the beginning. But the research is really strong that this is where your money and your time is better spent. You're more likely to get more positive benefit here. Anything else there, Bill, or shall I carry on? All right, I'm moving
Yeah,
on.
yeah. Well, there was a question about Durolane for
Oh yes, we'll
treatment.
wait. I'm gonna get to second line, and so we'll
Yeah,
we'll chat about that there. Perfect.
right. Good.
Okay. So first thing, I've been talking for 30 minutes. So if you're sitting down, please stand up, move around a little bit, give yourself. I'm gonna stand up too. Oh, just do a little stretch, a little turn this way, that way. Do something. If you don't want to stand up, straighten your knees, roll your ankles, lift your arms. Just do something so that you don't end this webinar feeling stiff and sore. Fantastic. Very good. All right, come on back down. Ooh, a little squat there, Bill. Love it. Awesome. Okay. So hopefully at this point, you are in agreement with me that exercising to manage hip or knee osteoarthritis seems like a good idea. Uh, but what exercise is best, right? Well, really, we want to have a combination of things. So there are some great activity guidelines called the Physical Activity Guidelines for Canadians that really outline how much exercise that we want to be able to get over the course of a week. And it's really no different for people with osteoarthritis. So what we want to see is that you are getting aerobic exercise. So these are activities that challenge your heart and lungs: walking, cycling, swimming, dancing, those kinds of activities. And we want to see for adults 18 to 64 and adults 65 and up that you get 2.5 hours of moderate to vigorous physical activity, aerobic activity in a week. Okay, 2.5 hours. Then, in addition to that 2.5 hours each week, strengthening exercises for the major muscle groups of the body a minimum of twice a week. And here is the part that's particularly important and relevant for people with hip and knee osteoarthritis is making sure that those strengthening exercises have this neuromuscular component. And this is the part where we talked about making sure that we're really connecting our brain to our body and focusing on position and alignment and how we're controlling our movements. So rather than being at the gym and doing a bunch of machines for strengthening, which are valuable exercises for strengthening your muscles, but not great for making your muscles smarter, right? So we want to make sure that we're including some neuromuscular strengthening exercises. And these in particular are things like sort of functional movements that we think of. So I love a squat, a step up, lunges, those kinds of exercises. I'm going to talk a little bit more about how you might go about doing that, but it's those kinds of exercises that we want to make sure are incorporated into a program of exercise with people who have hip and knee osteoarthritis. And then the last part is flexibility and mobility. And this is not only of the muscles surrounding those joints, but also of the joints themselves. So we want to make sure that we're optimizing joint movement as well as muscle movement. This is my favorite. I always put John Doe PT because I'm not sure who said it, but motion is lotion for our joints, right? Our bodies were built to move and our joints were built to move. So that very act of moving is like applying lotion inside the joint and is one of the best things that you can do. So you have to figure out which motion is going to be your lotion, right? Which aerobic exercise do you like? Which strengthening exercises are suitable for you? But it is really important to make sure that you're finding a way to treat your joints kindly. And so now you may be thinking, but what if it hurts too much to move? Right? Sounds good in principle, but what if it hurts too much to move? So this is where our second line of treatment can come into play. So I talked about the fact that the exercise itself may actually help reduce your pain over time associated with being physically active, but maybe it just doesn't feel reasonable to get started because things are so sore. And so this is where often we need to look at that second line of treatment to see what else can we add into the equation here so that we can get that healthy level of physical activity. And this is certainly not an exhaustive list of second line treatments. And I will talk about Durolane here as we make it down into medications. But it's a good start. And again, happy to answer any questions that people have on sort of expanded in this area when we get to the Q&A here shortly. So on the self-management tool side of things, the very first thing is recognizing that activity modification is often something that we need to consider with osteoarthritis. Osteoarthritis is, especially in the early days, a fluctuating type condition. You might have good days, good weeks, bad weeks, right? And so we need to have the skills and knowledge to understand when we need to modify our activities and how to do that, right? And so having some professional guidance from someone like a physiotherapist can really help you understand where we need to make those concessions and where you can safely push a little bit if you want to for the activity you want to be doing. That feeds into this idea a little bit around pacing, but then I've also got bracing and gait aids. So when it comes to bracing, there isn't a whole lot from a hip osteoarthritis perspective that I've seen be helpful. When it comes to the knee, though, we've got, I mean, you could spend a small fortune. You could probably spend a large fortune, frankly, on knee bracing if you wanted to. And there are lots of different options out there. And what's right for one person isn't necessarily the right solution for the next. Not because the brace isn't good, but just because each person's needs are a little bit different based on the health of the joint, your overall physical activity and health and strength, and the activities that you're wanting to be able to do, as well as where the disease is actually in the joint itself in terms of how the joint's being impacted by the osteoarthritis. So, on the bracing end of things, the sort of basic would be like a compression sleeve. Lots of people with early knee osteoarthritis find that's helpful. It gives a little bit of compression that helps with a little bit of early swelling, keeps the joint warm. That sometimes helps it stay a little bit more mobile as you're active. Then we can move up the chain in terms of types of bracing, and you've got some braces that actually have like metal struts on the side, and that reduces how much twisting and side to side action can, or side to side stress can happen on the knee. Then you can actually get into a custom fit brace. Most commonly in the knee, we talk about unloaders or offloaders, where the brace actually pushes pressure from one side of the knee, the affected side of the knee, over to the other unaffected side of the knee. And so that can make it more comfortable, maybe to walk a little bit longer further. Those are pretty helpful for a number of people. However, there's another brace that actually was developed, it originated in Dartmouth and is still developed and produced in Dartmouth, called a spring-loaded brace. And so for anyone who's got kneecap osteoarthritis, which traditionally has been very difficult to manage, this spring-loaded brace, I've just started to see it in action myself, and it really is a game changer for people that have knee osteoarthritis causing pain right at the front of the knee, as opposed to at the inside or outside. So that's a good option to look into. Should you need something in order to be able to be more physically active. Remember, all of these tools are designed to just be able to keep you moving more comfortably. And then gait aids. So this could be canes for sure. It could be a walker, could be walking poles. I am a gigantic fan of walking poles. There are a number of different poles out there, some that are designed mostly for fitness type walking, some that are designed more so for a stabilizing impact. And excuse me, the stabilizing poles I find particularly helpful for people with hip and knee osteoarthritis because they provide some joint offloading as well as a balance point. So we're less likely to have sort of stutter stepping that might create a little bit of extra pressure in the joint. So all of these things again can help you just hopefully, particularly with these ones, walk maybe a little bit further more comfortably. Next up on the self-management tools are hot and cold. This is probably one of the questions I get the most as a physio. And the research is really mixed. It really sort of says, well, whatever feels better is probably the right answer for you. I would say, as a physio, I generally recommend to my clients, if your joint is just its sort of regular sore self, then and it's just kind of achy, but it's not really sharp. Often, if heat feels better or if heat feels good to you, then putting heat on for 10 or 15 minutes is often helpful. But if you know that you've accidentally overdone it with an activity or you had a sudden movement that was painful to do or right away, then I usually find using ice is most helpful. We still want to make sure that we're still moving. So we don't want to ice it and keep the joint totally still because remember, motion is lotion. We need to move it. But I usually find that ice in those scenarios is more helpful from a pain relief perspective. So that again, hopefully you can get moving faster than without. On the medication end of things, again, as a physio, far be it from me to tell you a medication to take, but I can tell you what the research tells us, which is topically, there are some medications that we can put right on the skin. So that would be, especially the ones with an anti-inflammatory in it, would be things like Voltaren or diclofenac. And those medications have an anti-inflammatory that gets absorbed through the skin directly to the joint. Some people find that that's helpful, some people don't. The next type of topical that you can use is something that just causes a sensory change. So the one we use in the clinic most often is called BioFreeze, but there are lots of different ones out there on the market. And really, the way I always describe it to people is, you know how when you knock your knee on the coffee table, after you swear, if you swear, the next thing that you do is probably rub your knee, right? Now, we understand intuitively rubbing our knee is not solving the problem, but it does feel better while you rub your knee, right? And so that's the way that some of these other sensory topicals work, is that they just distract your nerves for a little bit. Same thing as a TENS machine, the little Dr. Ho's electrical impulses. Not building you an abdominal six pack, nor is it making your leg muscles stronger, but it can give you a little sensory distraction from the pain that you're experiencing. And again, hopefully that helps you feel more comfortable and confident to move some more. So those are good topical options out there. Again, always checking with your healthcare provider to make sure that they're safe and appropriate for you. Next, when we talk about oral medications, when we look at, so this would be like a pill, when we look at what the research tells us, it tells us that non-steroidal anti-inflammatory medications, so things like ibuprofen, Advil, naproxen, Celebrex, meloxicam, that whole category of medications, are the medication that are most likely to be helpful from a pain relief perspective. However, those medications also carry with them risks associated with blood pressure and gastrointestinal or GI issues. So before you take those medications, you need to talk to your healthcare provider and make sure that they are safe and appropriate for you. The research also tells us that Tylenol is not helpful. And that's often surprising to people. Because it is regularly still prescribed. And part of that is because although Tylenol certainly does have risks associated with it, they're generally considered to be less problematic. Those risks are less frequently a problem than those associated with the other class of medications. But Tylenol is often not helpful. And that would be like acetaminophen. So again, talk to your provider about it, and you've got to trust what seems to work for you. But the research would tell us that those NSAIDs, or those non-steroidal anti-inflammatories, are the ones that are most likely to be helpful if they can safely be taken. And then to answer the question that was in the chat there about Durolane. So Durolane is an injection that can be done into the joint. The substance is actually hyaluronic acid. Sometimes it also goes by Synvisc. And these are injections that are intended, the material that goes in, the hyaluronic acid, is viscous, so it's a little squishy, and it's intended to give your joint just a little bit of lubrication and shock absorption to try to reduce the pressure between the joints. Again, the research behind it is a little bit mixed, but the risk, relatively speaking, is low as compared to something like cortisone. And some people do find that they could get good relief with it, and that they can do it on a repeated basis. So, I've heard from a couple people, sometimes the biggest risk with that, outside of the fact that it's an injection, so there's always infection risk, but the biggest risk is just your pocketbook, because most health insurance plans don't cover it. And so it's often a few $100s to have an injection. So hopefully that gives you a little bit of guidance on that. So figuring this all out for yourself, right? Hopefully I've been somewhat helpful here and you feel like you've taken away a few nuggets, but figuring this all out for yourself is hard, right? So it's good to have some guidance along the way. You got a question there, Bill?
Yeah, there was a question about Tylenol
Yeah,
because people who are heart patients aren't allowed to take
right.
Tylenol. So what should they do?
Aren't allowed to take Tylenol, or aren't allowed to take the
Yeah,
anti-inflammatory?
sorry, are allowed to take the others. So Tylenol is the only thing they can take. Or
That's right.
yeah,
Yeah. Yeah. And this is where, again, like as a physio, right? I can't prescribe medication that's outside my scope as a physio.
right,
And so if there's a medication that you can't take because it's contraindicated or it's not allowed based on your health condition, other health conditions, then oftentimes those other health conditions win, unfortunately, and the pain associated with osteoarthritis does not win. But the good news is medications, remember, are a second line of treatment. That shouldn't even be our go-to. Our go-to should be education, exercise, weight management. And then we've got all of those other things in our second line of treatment: bracing, walking aids, activity modification, heat, ice, TENS machine, topicals. Like there are lots of other things that might take a little bit more effort figuring it out, like I've got on this slide, right? But there are lots of other options, and it's not as quote unquote easy as popping a pill, but it can be just as effective. And so the question is just figuring out what the right recipe is for you that you can do based on, again, your whole health condition.
Okay. There are a number of other questions, but maybe you want to finish up before I get to
Sure. Yeah, I think I'm getting kind of close. You know me, I can talk.
that.
I won't keep us here till midnight, I promise.
Okay.
Okay, so this was all leading into professional help can help, right? This is what we're here for. So physiotherapists can be a valuable member of your healthcare team, helping you navigate your symptoms as they change and evolve over time, because they will change and they will evolve, and figuring out how to handle those changes. Sometimes it's pretty intuitive and you'll be able to do it on your own, and sometimes having somebody help you sort of guide through that process can be really helpful. And so sometimes that's just in a one on one setting with a physiotherapist directly, but it can also be in a management program. So I talked at the very beginning about this GLAD program that we've been offering at Zoomers since 2018, and then Spring in Cole Harbour also offers it. And again, we are just two delivery sites. There are other delivery sites around HRM and across the whole country. And so it stands for Good Life with Osteoarthritis from Denmark. It's a 6-week exercise and education program specifically for people with hip and knee osteoarthritis. It was a physio in Denmark who was so frustrated by the fact that the evidence was so clear what people with hip and knee osteoarthritis should be doing for treatment before they considered having surgery. And yet, despite that, in the community, she was seeing lots of people who weren't being offered that kind of care. They were going straight to surgery or medications or injections. And so she wanted to develop a program that was easy to implement, that could get this information out to people in real time. And so it's informed by the evidence, and the goal is to improve each participant's ability to self-manage their hip and knee osteoarthritis through, you guessed it, education and exercise, right? So what does the GLAD program look like? This is, I do a lot of talking about this program and the importance of exercise with osteoarthritis. And sometimes I have GLAD participants who have joined me in other presentations, and they are always quick to hop on and say, it's important that you understand that these are exercises that everybody can do. This is not getting in a squat rack and doing really sort of overwhelming, complicated moves. These are functional movements, easy to set up. If you have a band, a little towel, and a chair and a wall to hold on to, you can do them, right? In fact, I often tell the story of we had, sorry, just a quick aside, but a patient came in one day and was telling me that she had done the GLAD program a couple years before, and she had been on a river cruise in Europe, and she was on the cruise doing her GLAD program that she had learned because it helped her control her knee pain, and she was in the gym on the cruise doing it, and then she looked over across the gym and saw someone else doing seemingly the same movements. And so eventually they had a little chat and they realized, yes, they were both doing the GLAD program. And in fact, they had both done the GLAD program at Zoomers and were meeting for the first time on a river cruise in Europe. Anyway, it's a small GLAD community. So just to say, it is, you come in, you do exercise twice a week for 6 weeks, but for an hour at a time. So it's an intense exercise program, but each person does the exercises in the way that's most appropriate for them and in the dosage or the volume that's the right amount for them. So you work out in a small group together, but everybody's program is similar but slightly different. The results after this program, when they did the research on it, average pain reduction of 30% by participants, less pain medication needed, increased walking strength, increased leg power and leg strength, increased walking speed. Sorry, I said that backwards. 47% and 50%, 47% in the hip, folks with hip osteoarthritis, and 50% for those with knee osteoarthritis reported having less fear of damaging the joint as they move through their life, which is so important. I can't imagine what it is like to feel fearful of hurting my body just moving around in my day, right? So to be able to reduce your fear that your day-to-day activities are harming you and damaging you is really, really powerful. And then we see that in terms of improved quality of life. So at 3 and 12 months after the program, people with knee osteoarthritis report that they have 21% improvement in their quality of life at 3 months and 34% at 12 months. So what we see is that later after the program, after continuing to be more active because you feel more confident, things get better and better, right? And then we see the same for the hip. So again, this just shows the power of some exercise. This was not people taking medication. This is just doing exercise 2 or 3 times a week, the right exercises with the right supervision, with the right education, knowledge, and confidence to get the benefits out of it. All right. So effective management of hip and knee osteoarthritis is absolutely possible. And it is so important for both the physical and the mental health impacts. It is never too late or early to start managing your osteoarthritis, right? So the faster we can get on it, great. But if you're already, really being impacted by your osteoarthritis, it is not too late to start. Okay. And appropriate exercise and self management strategies really are key in optimizing your success to live a life you love, which we believe you deserve, right? And I hope you believe you deserve. So just takes a little bit more work when you've got something like osteoarthritis that needs some management. And just as a reminder, if you answered yes to 2 or more of those questions at the beginning, again, you are probably being held back because of your joint more than you realize. And we can help you with that, right? So we are here to help you reduce your pain, improve your confidence, get back to the things that you love. We're just a phone call away. Like Bill said, he's going to share our information with you in the email that you get in a couple of weeks. And this is just a snapshot of some of our team. Super, super serious bunch, just like me. Okay, so let's
I'll
go
go with the
to,
questions. And the
yeah,
first one, someone asked, what was the name of the guidelines that you asked or you mentioned early in the?
yeah. The physical activity guidelines. And actually, I'll get a link to them here because they're freely available online.
Good.
So ask me the next one and I'll
And
find
we'll
that
put
one.
that with, yeah, yeah.
Yeah.
Which side should you hold or use a cane?
So you should hold it, unlike what Hollywood would tell you, you should hold it in the side opposite your most painful joint.
Right. Yeah.
And I just put in the chat there, the guidelines.
Yeah. And
And
we'll put that in the recording too.
perfect. Okay, and I'll find the second one. Those ones are the 18 to 64. But I'll find the 65 plus ones.
Okay.
Okay,
What are
what's
your
our next one?
thoughts on walking backwards?
Yeah, walking backwards is it's a thing at the moment. So walking backwards is a great way to strengthen what we would call your posterior chain or the back side of your body, right? So it strengthens your buttock muscles, it strengthens the back of your thighs, your hamstring muscles, encourages some good ankle flexibility, which is great. Uh, the trick with walking backwards, so strengthening the back of your body is good. We weren't designed to walk backwards all the time, so walking backwards for long periods of time potentially creates some problems for us, and it depends on your overall joint health and also stability. Walking backwards can be a real danger for falling backwards, and so I would never want somebody doing that who had any sense of any sort of balance disturbance. So if you were thinking about doing that, that would be one of the ones I would say, maybe talking to your healthcare provider, like your physio, about the safety and appropriateness for you is probably best.
Okay. Somebody says, I suffered from long COVID, tend to get out of breath walking and stop at times. Is there a good way to manage walking? I have a bad hip as a result.
Oh, yeah, COVID. That is what I'm on the back end of yet again. So, you know, when it comes to hip osteoarthritis, those stabilizing poles, walking poles, are one of the things I have found to be most helpful for people from a pain relief perspective as they're walking. So that would be one thing to consider. And again, getting some guidance on how to use those properly and the right pole for you is probably helpful. That's certainly something we do a lot of. Um, the breathlessness bit, it's important to probably try to stop before you feel really breathless so that hopefully you can take a shorter break and then be able to go again, or go a little further. And the other thing is remembering that when we're talking about trying to sort of get our 150 minutes or 2.5 hours a week of cardiovascular or aerobic exercise, that we would consider a 10-minute bout enough to count towards that 150. So if your heart and lungs or your joint doesn't allow you to walk for more than 10 or 15 minutes right now, then stay with that, but maybe try to do that twice in the day. Instead of going for a half-hour walk, do 2 10-minute walks to start and gradually build up.
Okay. Question is there a GLAD program in Cape Breton?
Ooh, great question. So I don't know offhand, but here's what you can do. If you go to, I will put it in here, www.gladcanada.ca. If you go to the link that I just put in there, there's a locations tab. And so you can click on locations, put in Atlantic, and then it'll pull up a whole document that tells you all of the different clinics that are offering it. The other option is that some clinics, including our clinic in Halifax, offers it virtually. And so, as long as, because it's offered as physiotherapy, you need to be in the same province as the person delivering it. But from Cape Breton, you would be able to attend our Halifax version.
Yeah, Cape Breton is still a part of Nova Scotia.
Sure is.
They may change that, but they're still a part of us. Right, Gail? Any suggestions on exercise that'll improve shortness of breath along with knee joint issues?
So, I mean, it really, shortness of breath can be driven by so many different things. So, talking to your doctor is probably important. If you've got shortness of breath, talking to your doctor to get a good check on your heart would be really important and probably step number one. If it's really, again, more about, you've just not been able to be particularly active because your joints have been sore, then it might just be about sort of going at things in that sort of, there's a little phrase going around these days called snacktivity, right? So trying to do your activity in snack size bites. So trying to do just a little bit at a time so that you don't get to that point of breathlessness. And then the other thing is when we talk about strengthening exercises, which are really, the aerobic exercise is important for sure and beneficial because of that loading and unloading of the joint when we talk about osteoarthritis management. But the exercises that I would say that I have seen be the most powerful are those neuromuscular strengthening exercises, which are things like I was showing in that picture, in that slide that had all the pictures of me moving with the band. And those exercises are not typically exercises that will cause breathlessness. So oftentimes, even if your heart and lungs are struggling a little bit, you might be able to do that functional strengthening exercises without having that same limitation.
Very good. Final one that I have here. Carol from the Valley says she tried walking backwards for a time, but it caused more pain. I think this backs up what you talked about earlier.
Yeah, exactly. Like I say, it's a bit of a, I understand it from a theory perspective. It's good to strengthen the backside of our body, but it's a bit of a fad. And so, it probably, with greatest respect to the 20-year-olds of the world, it's probably great when you're 20, right? But for the rest of us, sometimes we've got other things that don't tolerate that well, or like I say, it's a little riskier from a balance and a stability safety perspective. Um, I see a couple of questions here about the GLAD program. The cost of
Yeah,
the GLAD
both the
program.
cost and the whether insurance might cover it.
Yeah, exactly. So cost is driven by the individual clinic that you take it at. So it can vary a little bit clinic to clinic. At our clinic, it's basically equivalent to, you do an assessment, so an individual physio assessment. The cost of that is $120 for that hour. And then it's 14 hours of time, so 12 exercise sessions that are an hour each, and 2 education sessions. And that is the equivalent of 6 regular physiotherapy visits. So it's just shy of $600. And yes, it is recoverable from your insurance. Um, so that's usually that is not a problem for people.
Yeah.
And yep.
Good. And are there menopause related symptoms that are related to osteoarthritis?
Yeah, that's a great question. And you know what, honestly, it's not one that I am terribly knowledgeable of. And as I read that, I think, well, I should get more knowledgeable about that. So I don't have a great answer for you. I suspect that, we know with menopause, even things sort of that are one sidestep, but things like sleep quality and the ability to get a good night's sleep, right? We know that that is impacted, and we know that muscle mass, maintaining muscle strength and muscle mass, is harder as you go through perimenopause and into menopause. And so, those things would probably put us at greater risk for developing the symptoms of osteoarthritis. But I can't speak directly to sort of the hormonal influence on things, although I suspect it probably is a thing. But it's not something I know enough about to say.
Very good. Well, we're over our hour. That seems to be all the questions. And Laura, I really want to lots of thank yous in the in the chat, as you can see, and
My pleasure.
fascinating for all of us. I think probably all of us here suffer from knee or hip pain in one way, or the other, and really valuable presentation that we will send to everyone that's on this list. And there were some people who registered but couldn't be here tonight, and they'll get it also and be follow up with that. So if you have further questions, please don't hesitate to contact Laura. She'll be glad to answer them and follow up with you. And we invite all of you to watch your email and attend the next CARP webinar. In fact, we have one in November, Laura.
Yes, November.
Tell us about that one.
Can I give it a
Yeah,
quick plug?
please.
Yeah. Excuse me. So my colleague, Judy Umansky, is going to be on talking about falls risk reduction. Safe, steady, strong, and safe. I think I've got those S's backwards. It's those 3 words mixed up somehow. But she is a wealth of knowledge. She's been practicing over 39 years. She worked for 11 years at the Johns Hopkins Medical Center in the States with complex medical care. And she is going to have all kinds of fantastic information around fall risk reduction to share with you. So I really encourage you to join for that. It's November 12th at 7 o'clock, I believe.
It is, yes.
Yeah.
Yeah. And we'll
And
be sending all of you who have registered for this will automatically get a notice of that also. And so we invite you to join us in that webinar. And I know there's a number of people from the Valley here today. Please check our website. We have another CARP presentation coming up in person at the new Wolfville Legion in the Valley next month. So look forward to seeing some of you there. So thank you all. Remember to continue to support CARP. And if you're not a member, go to carpnovascotia.ca and join for $20 a year. You can help us continue this kind of really worthwhile webinars. Thank you, Laura, and thank you, everybody, for taking the time to be with us tonight.
my pleasure. Remember, motion is lotion. Get up and move.
Motion is lotion. Got you.
Bye.